Hello, I'm Dr. Jane Murray. I'm a family physician on the staff at Advent Health. I've been in practice for approximately 40 years and have had quite an interesting career over my lifetime. I've been chairman of family medicine at KU Med Center. I've been the director of education for the American Academy of Family Physicians, but in the last 23 years, I've had a private practice in integrative and functional medicine. And now, in the last couple of years of my rewirement, not retirement, I'm doing mostly consultations in integrative and functional medicine. And I have been learning about a new condition called chronic inflammatory response syndrome, or CIRS, which I am starting to believe might be a hidden epidemic because I have seen many people over the years with unusual symptom complexes and things I can't always figure out, and I've been sort of stupefied about what to do. And I think it's really something to pay attention to. So the goals today for our session are to really try to understand this concept of chronic inflammatory response syndrome and what causes it. And then discuss some of the controversies around the diagnosis and management of this, what I would say rather new condition is. So like these cute penguins who are paying attention, looking forward at the speaker, I hope you'll pay attention today and have a good time. So what is it? What is CIRS? It is an inflammatory immune response syndrome that was first described in the late 1990s by Richie Shoemaker, who's a family physician in Maryland, who was seeing a number of patients who were fishermen off the coast of Maryland presenting with very odd symptoms, neurologic problems, tremors, cognitive changes, lack of concentration, body pain, things he didn't understand and couldn't see a reason for. And he got to working with a marine biologist who found that there was an algae growing out in the ocean where these fishermen were working that produced a toxin called Pfiesteria toxin. So that's the first time we ever really heard about Pfiesteria toxin, which we now know is very toxic to humans, and it's probably why some of your local parks and ponds and playgrounds that have water have signs during the summer that say dangerous toxic algae here. Don't swim, don't fish, don't let your dog go in. That's Pfiesteria toxin. But this biotoxin response with these neuroinflammatory symptoms are now being seen also in people with other biotoxin exposure, particularly mold, and we call these mycotoxins, that come from water-damaged buildings. Also people that have chronic Lyme disease or chronic viral diseases like Epstein-Barr, which is mononucleosis, they can have sort of a biotoxin response to their immune system as well. So how do these toxins affect us as humans? It can cause a lot of different problems, as you see. Immune dysregulation, so a hyperimmune response that is not dampened down by the normal processes. These toxins can be damaging to your mitochondria, which are the little organelles inside every cell that make energy. Very, very important that they work well. These toxins can affect your pituitary and hypothalamus, so then all of the hormones in the body can be affected. We can actually see induced gluten sensitivity from mycotoxins. Somebody who wasn't sensitive to gluten before, now after this whole immune dysregulation problem, now they can't eat gluten. We can sometimes see colonization of fungus in the sinuses, which then provides a location for these toxins to keep being produced by the mold. And it's similar to what we were seeing with Gulf War syndrome, which was a biotoxin-related condition. People with chronic Lyme have many of these same symptoms, and it's not so much the Lyme bacteria that's the problem, it's the toxin that the Lyme bacteria are making. So there are some blood tests that can be done to look for CIRS. These pro-inflammatory cytokines that you've probably never heard of, the interleukins 1, 6, 8, 12, and tumor necrosis factor alpha can be elevated. So that tells us the inflammatory response is hyperactive. We can see high complement activity. That's another part of the inflammatory and immune system that's overactive. As I mentioned, melanocyte-stimulating hormone, this can get highly reduced, and that is a hormone that actually calms the immune response and is really the conductor of the endocrine orchestra. It's part of the pituitary system. It controls the tight junctions in the gastrointestinal tract, so you can start getting leaky gut from mold toxin that causes your MSH to decrease. And MSH, melanocyte-stimulating hormone, produces melanin, which helps, and melatonin, which helps your sleep. There's another cytokine marker called transforming growth factor beta-1, TGF-beta-1, that we can check for, and that's often highly elevated in these patients. Then this vascular endothelial growth factor, VEGF, is reduced, and that's a vascular growth factor that helps support circulation. So cells do not get oxygen. They are hypoperfused. So I know I've given you a lot of medical terms here, but I think when you look at this, you can see that there are many areas of the body that are affected by the toxicity of these biotoxins. So then the next question becomes, well, how common is this? Is it just a highly rare condition? No, it's very common. The Occupational Health and Safety Administration, OSHA, estimates that 50% of buildings in America, schools, homes, offices, even hospitals, have water damage. And so there is then cause for potential mold growth. And additionally, about a quarter of the population has a genetic type that makes them much more susceptible to this problem because they cannot make antibodies to these toxins. They cannot fight this war coming at them, and therefore they have all of these inflammatory, immune, and hormonal responses. So if we have 50% of the buildings and 25% of the people in those buildings being highly susceptible, we think there's about 40 million Americans who have a probability of having a biotoxin illness caused by mold exposure. So how do we get these toxins in our body? We can mainly through respiration, through inhalation, through our lungs, through our sinuses. We can get a colonization in the nasal passages, and this mold toxin creates a biofilm, a sort of a coating that makes it very difficult for antibiotics and treatments to actually get to the mold. It's a sneaky little organism. We can also get mold toxins into our body through skin contact. And so if someone has, decided, yes, my home is contaminated and I'm going to have to move, but they take all the belongings that they had in their former home, books, papers, etc., and bring them into their new home, they still have the dust with these toxins in them. So you can get them through skin contact. And you can get them from food. There are certainly, we know, foods that have mold on them, cheeses, the rims of certain cheeses, grapes, peanuts, those are all foods that actually have mold on them. So it's potential that we could get mold into our system that way, and then they could create these toxins. So I get asked a lot, is this SIRS problem, is it an allergy to mold, or is it a fungus infection, because molds are fungus? No, it's not either one of those. So testing for mold allergies isn't really helpful. Testing for fungal infections might be helpful if you think there could be a sinus colonization. It's really a physiologic inflammatory response to the toxin, not the organism. Okay, so that's the big difference here, and this is something that has not been well understood. So the mold spores, they're the growing mold that you cannot see. You see growing mold that's gotten wet. These mold spores are dry. They create these toxins. When they get wet, they then bloom into mold colonies that you can see. But even if your house has been remediated and you don't see mold, if the mold spores have not been cleaned out, they can still emit toxins for years. So it's important to understand this differentiation between the mold organism and the mold toxin. So we're not talking about mushrooms, which are a type of fungus or a type of mold, and we're not talking about the mold that you can see in your home. We're talking about this. These are mold spores. This is kind of a microscopic picture of these little black dots growing on the edges of these little arms. So this is what's in dust, and you cannot see this. So this is where the danger lies. But these are the different kinds of mold, the toxins, the specific toxins they make, and what those toxins do. So this is a condition that is hard to diagnose, and it's confusing, and it's not, as I said, well understood yet. So patients with a lot of symptoms come in, and they could get misdiagnosed as having chronic fatigue syndrome, or fibromyalgia, or Lyme disease, multiple sclerosis even, Parkinson's disease, inflammatory bowel disease, irritable bowel disease, because there can be a lot of gastrointestinal symptoms, chronic allergies, all the different autoimmune conditions, depression, anxiety, somatization disorder. Well, you're probably depressed and you're having these physical symptoms from that. Even post-traumatic stress disorder and Alzheimer's with dementia. So lots of chronic problems that we see in healthcare today that are troubling people desperately and may or may not have wonderful treatments, may actually not be those conditions. They may be the manifestations of mycotoxicity. These neurocognitive changes are quite common because the brain gets inflamed. We call that neuroinflammation. So we see behavioral disorders in children, ADD and ADHD. We see depression and suicidality in patients and even children that have mold toxic syndromes, anxiety, cognitive changes. I started to learn about this problem because I was seeing a lot of people with dementia and Alzheimer's disease, and we have to look for the cause of that in functional medicine. One of the causes can be a toxin like this. Balance, coordination issues, tremors, movement disorders, and then abnormalities in intelligence testing, these SPECT scans, quantitative EEGs, and quantitative MRIs. So the brain is highly susceptible to this type of inflammation from neurotoxins. So what kind of tests can we do? There is a visual contrast sensitivity test that a person can do online. It's at vcstest.com, and you can see if there's a subtle change in your ability to see the difference, tell the difference between dark and light and gray lines. And actually, the military developed this test to test people coming back from deployment who might have been exposed to a biotoxin, because one of the first things that changes is the brain and the visual system. There's a symptom cluster analysis I'll show you in a minute. There are some blood panels that we talked about briefly, and then there's a brain MRI with a special software called NeuroQuant. So there are things we can do to actually quantitate and see if this could be the problem. Here's a sample of the visual contrast sensitivity result. It's at that website, vcstest.com. The cluster analysis is interesting. So there's these 12 boxes, each of which has several symptoms in them. Some of them don't even seem related, like why would diarrhea, abdominal pain, and numbness be in the same box? I'm not exactly sure how the people that have figured it out. But so you look at this, and if you have 6 or more boxes checked, not specific things, but something in a box, then you have a high possibility of having a problem with SIRS. So here are the diagnostic markers. There's a genetic test for the human leukocyte antigens, HLA types, which is, when I mentioned earlier that 25% of the population has a genetic type that makes it so they don't make antibodies to mold toxins. That would be the test to look at that. We can check the MSH, the melanocyte stimulating hormone, and other hormones like cortisol, DHEA, those are adrenal hormones, the adrenocorticotropic hormone from the hypothalamus, and the vascular endothelial growth factor, that vascular hormone that can help improve circulation if it's normal, or decrease circulation and oxygenation if it's low. The cytokines we talked about, TGF-beta ones, this one called C4A, which actually no lab in our area in Kansas City actually does that test anymore. MMP9, leptin, high antibodies to gliadin, that's gluten antibodies, cardiolipin, which is another one that can go with autoimmune diseases, and then a whole series of regular blood chemistries. This is an example of the quantitative MRI that I mentioned, the NeuroQuant, and it is a special software that right now there are no radiology practitioners in Kansas City who have this software, but we can get the MRI taken locally and then send the information to a couple of places in the country that actually can tell us the quantitative size of various specific parts of the brain. I won't get into all that, it's highly technical, but we can see correlations between what's wrong with the volumes of, for example, the caudate nucleus and putamen, who are atrophic, which are atrophic. They're smaller than they should be. Or a swelling enlargement of these other ones, palladium and amygdala and the right forebrain, the hippocampus. Those are all things that if you're a neurophysiologist, neurologist, you know about these. If you're a normal person, you've probably never heard of them. So we can actually get volumes, which we don't get on a regular MRI, that tell us whether this is consistent with the neuroinflammation seen in mycotoxin exposure. So getting your environment tested is crucial, because if you're in mold, it doesn't matter what you do to try to treat yourself, you will never get better if you're continually exposed. So all of these places, your home, your workplace, school, etc., are potential places to be checked. As a sidebar, I will say many of my patients say, well, I live in a brand new home. It was just built 2 years ago, and so I know it has no mold. Au contraire, have you ever seen a house being built and there's a rainstorm and it's just wood, there's no roof, the wood gets all wet? They are not taking big dryers and drying it out before they get everything finished, sheetrock, insulation, etc. And we know of some famous homes that have had to be torn down because their mold was in there and it was a brand new construction. So the tests that we do are an ERMI, Environmental Relative Moldiness Index, which was developed by the EPA, and it is not an air test. It is a dust test. You actually collect dust samples from around your home or school or office or wherever you think the mold may be, and then that gets tested for the mold toxins. There's another one called HERTSMI, 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 because it hurts me, I guess, but it stands for this, Health Effects Roster of Type-Specific Formers of Mycotoxins and Inflammagens. Don't you love healthcare? Big words. But the scores on these tests should be certain numbers to be safe to live in. And the people doing the testing have to understand this SIRS condition, because many places are doing air testing. And if you go to Home Depot or Lowe's and you pick up a home test, those are air tests. They are not sufficient to find mold toxins. They have to be on surfaces. So this is, again, hard to read. This is an ERMI test. I think the score on this is like 14. It should be less than 10. Actually less than 4 to be safe. I tend to use this HERTSMI test a little bit more because it sort of takes into account a lot of different things, and the score on that should be less than 10. This one's 26. So this person needs to either get out of that house or get it remediated very, very quickly. Okay, so let's say you have the symptoms. You have a positive SIRS cluster analysis score greater than 6. Maybe your VCS test is abnormal. You have a cluster of weird symptoms. Your house has mold and you've gotten it remediated. So what we have to do is get the mold away from you. So either your house gets remediated, you don't work in the office that has this mold, or you move. And some people have had to move. Then we support the detoxification of getting this toxin out of your system, and then we work on repairing tissues. So here's the deal. My house was cleared of mold, but I'm still sick, and that's going to be the case until the mycotoxins in the body are removed. They have to be bound with something we call binders to get them out of your digestive tract, because what happens is these things recirculate in your enterohepatic liver biliary system until they are bound and removed. So we give people binders like activated charcoal or ochre or bentonite clay. Those are over the counter. They are not especially effective if someone's really sick. We have to use prescription ones like cholestyramine or colesevelamine, Welchol. And those bind this toxin and get it out of your system. So that has to be done. And then you have to get rid of not only the visible mold in your home, but all the items that can't be cleaned. You need high potency HEPA filters, you need air vents thoroughly cleaned, and you of course have to fix anything where there's leaks, tile, kitchen, roof, bathroom pipes, anything that's leaking. You can't have any leaks in your home. So we talked about how we get you detoxified, GI binders, and be sure you're not constipated, having at least 1 or 2 good stools every day. Get this stuff out of you. Sweating through a sauna can help detoxify. Some substances called glutathione and N-acetylcysteine, or NAC, these are over-the-counter supplements that support your liver detoxification pathways, which is really important. And then NRF2, which is a key protective factor for brain inflammation. Things that help stimulate that particular substance are curcumin, coffee bean extract, and an herb called ashwagandha. So all of those are probably very important. We think that treating people with systemic antifungals, this is an approach some doctors take, and it's a little bit controversial because the problem isn't necessarily a fungal infection. As I said earlier, it's the mold toxin. But if you've got mold sort of growing, say, in your sinuses, you probably do need antifungals to get rid of that. There are nasal preparations that can be used via spray or nasal nebulizer. There are things that can help get rid of that biofilm I mentioned, that sometimes these mold spores can create this biofilm that's hard to treat, so there are surfactants and anti-biofilm products we can use as nasal support. And supporting the immune system with colostrum can sometimes be very helpful too. More recently, there's been some work done on something called vasoactive intestinal peptide, VIP, which is a nasal spray that has to be compounded. It's why would an intestinal peptide help a mycotoxin? It's because it's vasoactive. It means it helps increase blood circulation, particularly to parts of the brain that are affected badly. So it can help increase that MSH level, which is an anti-inflammatory, pro-sleep, pro-hormone production precursor. We shouldn't use this if people are still exposed to mold. It doesn't work very well and it's rather expensive. So I want to just share one case with you. This is a 67-year-old woman who presented with fatigue, depression, insomnia, brain fog, memory changes, headache, bladder pain, GI problems. She also had thyroid issues, musculoskeletal condition, and PTSD. And as an aside, she had experienced multiple adverse childhood experiences, which there's been a number of research studies done now, large studies around the world, looking at the incidence of chronic disease among adults who were abused, neglected, disenfranchised, bullied as children. Because that experience leads to some changes in the brain and the nervous system, and it sets a person up for immune, autoimmune, behavioral health, and other chronic diseases. So that's another talk that could take a whole hour, so we won't go there. But she is one of the many people who ended up in her adult life with many of these symptoms. And honestly, we find people with mycotoxin syndromes like this very frequently have a history of multiple ACEs in childhood, a hard, tough childhood. We did find mold in her home. She had a neuroquant brain MRI that was consistent with the SIRS from water-damaged buildings. Her lab in January of 2019 showed a very high TGF-beta1, that's that cytokine marker, low MSH, an OK MMP9, another cytokine marker, and then she had a nasal swab for a bacteria that's called MARCoNS, multiple antibiotic-resistant coagulase-negative staph. It's not MRSA. It's a different kind of staph, but it is not susceptible to very many antibiotics, so we have to use some special treatments for that. So this patient moved to a new home in September. She'd had all these tests in January. She took cholestyramine, one of those binders that gets rid of the toxin in your system, gets it out. She used this nasal spray for her MARCoNS situation, and then a year later, in January, she added VIP nasal spray. So by March of 2020, she said, I feel so much better. And she was having improvements in all of these parts of her complaint, multi-system disorders. Her labs were much better. Her TGF-beta was now low. Her MSH was a little better. Her MMP9 was even better. And I recommended that she do this retrainingthebrain.com. It's a dynamic neural retraining program for the limbic system. It especially works for people who've had all these ACEs, and their brain has been hypersensitized to danger and trauma. And these people really benefit from this kind of treatment. Okay, so we need to discuss some of the controversies about this because it's still not really a mainstream, well-accepted, well-understood condition. Many practitioners are doing urine testing for mycotoxins to see if a person has them in their system rather than all these lab tests that would be markers of possible biotoxicity, but let's just do a test for mycotoxins. Lots of practitioners feel those tests are not accurate and they don't necessarily represent the true state of the person's inflammatory response. Should we treat people who have mycotoxins with antifungals? That's controversial. Some practitioners believe that's important, others do not. This nasal swab for MARCoNS is another controversial situation. Many practitioners believe that you can't get the person better if you can't get this bacteria cleared up. I've had colleagues say to me, well, is this even a real diagnosis? We don't have one of those ICD-10 codes. So if we don't have an official code to code it, maybe it's not even real. The situation, I think, is that it's so new, it hasn't been vetted and looked at by the large committees that give ICD-10 determinations on diagnoses yet. So I have to say, from my experience, I know it's real. I see it all the time. People get better. All of these weird, unrelated symptoms can get better with the proper interventions. So another concern is that most of the research and publications have been done by one group, Dr. Shoemaker and his associates. I don't know if that's because other people are not doing this research, but there hasn't been research disproving what they've found with SIRS and how to manage it. So I think it's, again, just very new, and it's not something drug companies are going to want to promote research, so those things don't tend to get studied as much. And then insurance coverage for these labs is quite variable. Some insurance will cover it, some will cover some of it, some won't cover any of it. Some of these tests can be very expensive. So that's another controversial feature. So it's not a done deal, it's not a be-all and end-all, but I think it's a fascinating new area to pursue, and it's something I've just become more knowledgeable about recently, and I'm finding really amazing success with some patients who have not been able to get well for many years because we haven't figured out what's wrong. So I hope I didn't bore you too much, and I hope you have a wonderful day. Thank you so much.